So, we're going. Good night, welcome to our show. Tonight's guest is Dr. John Landis. He's the director of the emergency room at Canonsburg Hospital, board certified in emergency medicine. John, welcome to the show.
Well, thank you. Nice to be here.
How are you?
Good.
Little weather issues tonight.
A little wet.
Now, since we didn't get a chance to do this, in my hand here, if you remember Johnny Carson, every question you want to know about the emergency room is right here on this paper.
I've got every answer.
That's what I want to hear.
All right.
Now, my daughter picked these questions, my 10-year-old, from True Stories of the Emergency Room.
Is that right?
That's right. So,
You know, they filmed that at Allegheny once.
did they?
Yes.
Okay, so the first question that she has is, have you ever seen a tree limb in the neck?
A tree limb in the
Tree
neck.
limb in the neck.
I have not seen a tree limb in the neck. I have seen a chainsaw to the neck.
Chainsaw to the neck.
Chainsaw
Okay.
to the neck. That was trimming and tree
That's
limb.
not good.
No.
Okay,
That
so
will get you killed.
that's not good. Okay, and we just had an accident the other day, quite tragic accident, as you know. Somebody was on the power. See that on the news? Yeah. Trimming down trees at a power line.
Ooh.
So if you're outside, you know, you got to use common sense all the time. Again, we're just going to talk about regular things that we see in the emergency room. John sees in the ER, things that my daughter has cooked up this evening. We asked a very important question earlier, and it's the Blue Oyster Cult. Who sang that? The song, the hit song was Don't Fear the Reaper. And later on, we'll talk about the name of the album, in case anybody's not allowed to Google either. I'll write it down here because God knows I'll forget. Okay. Remind me at the end of the show.
I will.
Okay. So, John, the emergency room, I saw a nice ad in the Observer Reporter today. Tell us a little bit about the emergency room. It's grown up since I started at Canonsburg 22 years ago.
It's grown up since I started there 17 years ago.
Okay.
Yeah. Well, we have a new state-of-the-art facility, 5 years old, that is completely decked out in all of the most up-to-date technology, from our radiography suite to our tracking boards and ambulance entrance. But even beyond the new facility, we still have kind of pride ourselves in having great care and fast throughput of patients, which is how quickly you're in and out of there, which all of our viewers can relate to, that you don't want to spend a lot of time in the emergency
Right. We actually saw one today that had been in another hospital. We won't mention its name, but waited and waited and waited, and actually decided to come to ours, and they were amazed at how quickly they came in, were seen, and actually were admitted to the hospital. You have how many rooms?
18.
18. And they're all monitored, state-of-the-art. You have trauma rooms,
state-of-the-art, right. 2 trauma rooms, separate ambulance entrance. We actually have a, God forbid we ever need it, we have a separate decontamination area. So it's really built to the state-of-the-art.
State-of-the-art. And as I recall, all the emergency room doctors are trained.
That's right. They're all board certified,
right.
Good number of them here locally at Allegheny General, where I trained also. I would say actually 75% of my doctors are trained at Allegheny.
Perfect.
Yep.
And as we know, it's really one of the state-of-the-art facilities. So now I'm going to hit you with some more of these true stories from the emergency room. Bug in the ear. Have you seen a bug in the ear?
Lots of bugs in the ear.
How do you get a bug in your ear?
They just crawl in.
I see.
They want a little place to
peace
stay.
and quiet?
Yep, little peace and quiet.
And how do we get the bug out of the ear, if I might ask?
Yeah, well, usually people will come in with buzzing sensation. Yeah, they do. And unfortunately, those wings sit right on top of the eardrum. And you know from having had cotton Q-tips stuck in your ear that someone might have retrieved. It's very painful inside the ear. So when those wings are really fluttering and moving, they're in agonizing pain. So actually what we do is put either a little saline or a little oil in there to suffocate the bug,
Okay.
and then I can take a pair of fine forceps and
Reach in and pull
pull
it
the
out.
bug out.
So this is probably something you want to not attempt at home.
No, you don't want to attempt it at home.
Okay.
You know, I have seen the size of bugs you wouldn't believe.
No, we're not
crawl
going to.
into
We're not
it.
going. We have a family show. We're
Grasshoppers.
just right after dinner
Grasshoppers.
here. No, we're not.
All
Doing
right.
it. We're not doing it. So, but we're able to take care of the odd and yet the exotic. My daughter also asked, have you seen a hook in the head?
I have seen a hook in the head.
Hook in the head. Tell us about the hook in
Like
the head.
a fishing hook.
I guess.
Well,
hook
I've
in the
seen a
head.
fishing hook. Nothing bigger than a fishing
Nothing.
hook.
Okay. And
Impaled in the scalp, and
that's just a careless angler.
that's a careless angler not casting quite right.
Now
Or
tell us
more,
about hooks. How do you get the
more
hook?
frequently, it's someone else.
Angler's friend.
Yeah,
Friend of
angler's
anglers.
friend not watching what they're
Yeah.
doing. There's
how
a
do you-
couple different ways to get them out.
Okay.
You can take a needle and slide it over the barb and back it out.
Okay.
And again, this is after you
Anesthetize the area. I would hope.
anesthetize the
Okay.
area, put a little Novocaine in.
Unless it's somebody that escaped from Guantanamo Bay, in which case.
We treat them all the same.
Treat them all the same?
We
Oh,
treat them
that's
all
it.
the same. We're not
No, I
partial.
understand. I understand. That's good.
Or you can push the hook through and clip the end of it off,
Got it.
and then pull it out.
Again, if you get a hook in your head, our ear is the place to go.
That's right.
It's kind of funny. I just got back from driving school.
That's scary.
I know, it's very scary. But I learned something about driving in school zones and driving on wet pavement.
Mhm.
And I'm going to share some with the audience, unless you want to share this with you.
Go right ahead.
Do you know if you're driving, I find out why the reason you have 15-mile-an-hour speed zones. And if you're driving 10 miles an hour, do you know how long it takes the car to stop, four-wheel disc?
I would say probably 20 feet.
Close, 8 feet. So if 10 feet, 10 miles an hour stops in 8 feet. Pretty good. That's
Mhm.
why now, if you up that to 30 miles an hour,
Mm-hmm.
it takes on wet pavement like 45 feet to stop.
Wow.
And so that's why when I got that, and you're standing there going, wow, that's amazing.
Mm-hmm.
So, we also, so you don't get involved in the emergency room in the accidents, the schools don't speed.
No.
Really. That's not good.
Right. You
Tell
get a
us,
big ticket, too.
So tell us a little bit about why would somebody want to come to the emergency room, say if they had chest pain? I mean, should they stay at home, thinking it's indigestion, take a couple Tums? What are the signs that somebody, if they're having chest pain, should come to the emergency room?
Well, that's a good question. We see all age ranges of folks that have chest pain that come to the emergency department. Certainly if you have some risk factors, or if you've had previous problems with your heart, certainly chest pain would be a reason to come to the emergency department. So you almost have to separate it into groups of people, but let's just take all comers and say that you're having chest pain. How can you tell? Well, you can't. You know as well as I do that I admit a lot of people to the hospital that come in with chest pain that maybe they're having indigestion, gastroesophageal reflux, gallbladder problems.
Better get some ice if you're going to talk about gallbladder problems.
So, if you're having chest pain, and you don't really have good reason to be having it, old muscle,
Right.
something like that, then you would want to come in. And if you're having any associated symptoms, shortness of breath, nausea, vomiting, sweating. What's interesting, as you well know about the female population, is quite often their presentation is completely different. They may just have fatigue. They may have some odd back pain or arm pain. They are very what we call atypical in their presentation. So it's important, being a female, to look out for symptoms.
Excellent.
Like
So if the pain lasts for, say, more than a certain period of time, half hour, 20 minutes?
well, that we used to try and base it on that, but it can be angina, can just last a couple of minutes.
Okay.
Typically, if it's just a sharp pain for a couple of seconds, it's probably not angina, but I have seen people who have had very atypical pain like that
Okay.
it turns out to be angina or
Okay.
pain related to a blocked vessel. So, again, time is not necessarily, certainly if it becomes a recurrent issue, certainly if it is a pain that is worsened with activity and relieved with rest, But there's a lot of other causes of chest pain just besides your heart. You know, if you've been traveling, had recent surgery, and you all of a sudden had chest pain and shortness of breath, you could have pulmonary embolism. So
Right. So you have a blood clot, recent surgery, get in and see somebody. When you mentioned younger people, let's say you're 17, 18, what would be a common cause of chest pain, let's say a 17 or 18?
Well, it depends on the nature of it, but I would say most commonly we see muscle strains.
Okay.
We see pleurisy in that age
Okay.
group. We see, very rarely, we see arrhythmias,
Okay.
some of the congenital arrhythmias causing chest pain. And what I've started doing with a lot of kids that come in, especially exertional-related chest pain, is going ahead and doing the workup, EKG and a chest X-ray, and
Okay.
trying to get them over for an echo to make sure that they don't have some stenosis that is common to cause that sudden cardiac death in kids when
Right.
they're playing basketball or sports activities.
Excellent. Tonight's guest, Dr. John Landis, board-certified emergency room physician, been at Canonsburg for almost 2 decades now. I'm over that 2-decade mark now, so I know. John, you know, we're fortunately not up against the Penguins tonight. We probably are up against the Pirates, which means that our rating should, again, be higher than theirs. Which is
I thought they were doing good this year.
They are, but they still can't beat us. This is the #1 ranked show in our market, which is amazing. You know, so Sid Crosby, you know, he knocked it ahead about a month or 2 or 3 ago.
Right.
And you know, we're seeing more and more of this concussions. Certainly, that's brought it to the forefront. And you know, I have some friends that actually play hockey, teach hockey, coach hockey, and I actually saw some interesting stuff recently. I actually saw it on ESPN, and they talked specifically about, you know, whether or not to let the kids under the age of 13, you know, throw body checks in hockey. And I saw a really interesting discussion from, you know, some former NHL players and their thoughts. And I just wanted to get an idea from you. Tell us a little bit about concussions, especially in the younger age group that you see. You know, when should people come into the emergency room, and you know, what happens once they see you?
Well, that's a good question, Gene. We see a lot of kids that come in with head injuries of various sorts, and typically, I would say a good 95% of what I see are really not severe head injuries, whether it's sports-related or otherwise. But that smaller percentage that do, they usually come in and they've either had a significant sports-related injury, maybe a fall off a bicycle, skateboard, whatnot, and they usually come in immediately because of a loss of consciousness. Okay. Or if they're delayed, they've continued to have nausea, vomiting, blurred vision, and some symptoms like that.
Okay.
And that's really what kind of has kept Sidney Crosby out, is he's exhibited continued cognitive tar paper or cognitive impairment in that he can't remember things, and he's, you know, there's a formalized test that has been developed that they put these folks through to determine whether they're still having some problems with their brain. So when they come in to see me, we'll do a detailed examination and determine if a CAT scan is needed to rule out any structural abnormality that might be there. And if the CAT scan looks okay, usually what I will do after that, if I've determined that they've suffered a significant head injury, is I'll refer them to a neurosurgeon. Okay. Not because they need surgery, but because that is the person that can then reassess them and guide them for continued evaluation. Okay. And that continued evaluation will really tell them, because Mom and Dad always say, when can they go back and play? It's after you see the neurosurgeon, and they determine that it's okay. Right. Because they need to ask you those questions.
When you see somebody that comes in, you know, let's say they took a heck of a shot, they go down. They don't, frequently, I assume they don't remember whether they got knocked out or not, but it's right. A witnessed event from somebody else for the most part?
Right, right.
What's the most common? Is it hockey? Is it football? Is it cheerleading? I mean, what do you most commonly see, or is it just, you know, across the gamut?
I think it's pretty much across the gamut. I would say that non-organized sports-related injuries are probably more common. Fall off a bicycle even with a helmet on. Okay. Good fall off a bicycle even with a helmet. You won't, maybe not crack your skull open, but you can still have a decent head injury.
And you mentioned concussion. When you do that CAT scan, which is the test they do, the pictures of the brain, does it show anything, or does it not show anything? Or are you doing that just so you don't have a bleed or something like that,
Right.
correct?
Right. Well, let's hope it doesn't show something. If it
Okay.
does show something, you know, we're looking at a pretty severe head injury with
Right.
a bleed of some sort.
Okay.
But in just the concussive state without bleeding, it won't show anything.
Okay. Is that person typically admitted to the hospital, or you keep them in observation in the emergency room for some period of time?
Usually if the injury was significant enough and they have continued symptoms, then I will send them for admission.
Okay.
And we would send that person to a trauma center.
Okay.
Because they have the specialized
Right.
folks, as you know, to take care of them,
Makes sense.
continue to monitor
But at
them.
least, so you're there on the front lines to determine exactly, is this serious, is this not
Right.
serious to the average person that doesn't
That's correct.
quite get it, which is fine. So then on CT scan, you won't see anything on a CT scan for concussion, correct?
Right.
There's no abnormalities on that.
That's correct.
Okay. In the old days, now because I'm really old and getting there, you had to keep the patient awake. You know, you get hit in the head with a baseball bat and you're kind of a little woozy, and then you had the helmet on. There are a lot of reasons why I act the way I do. But they kept you awake for like 12 hours? I mean, what was with that? Is that like old wives' tales nowadays, or is that's still something we do?
No, that's not old wives' tales. Really, that stems from the fact that, you know, you don't want to let someone go to sleep who's had a head injury and then just keep sleeping, and then go to wake them up 12, 14 hours later and they won't wake up because they've had something significant.
Okay.
You know, really in the pre-CAT scan days, that's how we would evaluate people. I mean, I haven't practiced without a CAT scan in my career, but pre-CAT scan days, mom and dad wouldn't take the patient to the ER.
Right.
If we're talking about kids. They would keep them at home, watch them for a while, and make sure that they didn't, that they woke up. And we still do that after you have had a head injury, and I give you detailed instructions about your head injury. Then what I will do is send you home with head injury instructions that indicate on them to wake the patient up every 2 hours.
Okay.
If I determine that it's a minor head injury, and usually it's a very fine line as to what separates those, but usually the patients I have that I have parents keep waking them up are ones that have continued symptoms, headache, maybe a little nausea, maybe a little vision problems, and again, our neurosurgeon referral, and for the next 12 hours they get wake-up head injury instructions.
Okay. Again, tonight's guest, Dr. John Landis, we're covering some of the common things we see in the emergency room, plus some of the things that my 10-year-old daughter decided to stump him with. And we have another one from the true stories of the emergency room. She wants to know if you ever saw spray paint in the face.
I've seen spray paint in the face,
Okay.
intentional and unintentional.
And so what do we do for spray paint in the face? Because my daughter at home is watching.
Right. Well, typically we would make sure that there was no problems with their airway.
Okay, so no
Make sure they
inhalation
didn't-
injury.
Inhalation.
Okay.
And the most common times that I've seen it has been intentional inhalation. It's called huffing.
Okay.
Yeah. So they come in usually with a metallic ring around their face, and it's from spraying it in a paper sack and
Okay.
breathing the fumes in, which is very bad for your brain.
Okay.
And once we determine that the airway is okay, then we check the eyes out.
Okay.
Eyes and the airway are
So
really
you have
the
to
only
flush
place.
flush out the eyes?
Yeah, sometimes. Most of the time, people's reflexes, believe it or not, are quick enough that
Okay.
before more than a couple droplets hit the eyes,
Eyes
their
closed.
eyes are shut.
Perfect.
So, and spray paint can induce a little chemical conjunctivitis, a little injury to the eye, but it's very benign. Flush it out, and they'll be okay.
Okay. So, obviously activity that we should not pursue nor encourage then.
Correct.
Okay.
That's correct.
Again, nothing to do over the weekend, reading the newspaper, and I see that there are people that keep these exotic animals.
Mm-hmm.
And I read about a guy that had some pit viper snake that's from like Africa or somewhere, and he got bit and he died because the closest antivenom was in Florida.
Mm-hmm.
And do you see this around here? Is this something that is this a problem here? Or is this something I read in the newspaper?
Is it a problem here?
Have
I'm sure
you
there are
seen
a
any
number
crazy stuff like this?
Sure. I'm
Okay.
sure there are a number of local people that have venomous snakes that they keep as pets. I don't know, they take them out and walk them? Or
I don't know what,
do with
you know,
them?
I read this article.
Yeah,
I live in a cocoon, I guess.
right. Well, as a health system, we have a cache of antivenom
Okay.
because it is very expensive. I can't give you an exact figure, but a whole treatment costs hundreds of thousands of dollars. So we keep a cache that if we were to have a snake bite, then we would send that patient again to a trauma center.
I see.
And they would administer the
Is there
antivenom.
anything to do, you're out in the field, I mean, is there any way to tell a bad snake from a regular snake? I mean, do they bite you routinely, or do you have to irritate them? I mean, if you're out walking in the woods, where do you know?
Yeah, most of them are accidental. There's not many venomous snakes in this area. There's
Okay.
a rattlesnake up in the Butler County area, but otherwise there's not. You would be more likely to encounter one outside of this area of Pennsylvania.
Okay.
Maybe a few copperheads, but there's
Okay.
not a whole lot of venomous snakes.
Now, are those ones that they're poisonous, but not poisonous enough to?
No, copperheads are quite poisonous.
Oh, they are?
Yeah.
Okay.
And a good number of snakes have a little bit of poison that, you know, won't actually make you sick. But most people who would come in with a snake bite probably were bit by a garter snake or a king
Okay.
snake or a black snake or something that...
Something that eats mice and is harmless. otherwise.
Right. And you can tell by those bites because there really won't be anything but maybe a little local inflammation. They won't have the immediate symptoms. And usually the puncture wounds are very, very shallow because
Okay.
they don't have, you know, the fangs that
Right.
flip out, reticulated fangs.
Okay. Well, you know, that's what I wanted to ask you about that. What are the more common injuries that you see in the emergency room, since we've talked about crazy things you
Mhm.
haven't seen, you know, the hook in the head you haven't,
Mhm.
or the regular hook, tree limb you haven't seen, tree limb in the neck.
Tree
you
limb, I
haven't
haven't. What are some of the common injuries? Well, you know, most of the most common thing that we see is back pain,
seen. Okay.
low back pain, usually work-related, sometimes not work-related. As you know, sometimes real, sometimes not so real. But in any event, most of the time it's musculoskeletal pain. People will always come in with their first episode of back pain and say, what about my discs? Well, we can't tell on a first time of back pain. You know, you really can't even get a good consensus from folks that read MRIs as to what
Right.
constitutes a significant bulging of a disc.
Okay.
So typically after plus minus some x-rays, and there's some criteria for who gets x-rays and who doesn't, there's really no sense in x-raying a 23-year-old that lifted something and now has some low back pain. The bones will look normal and it won't be a test that shows us anything. However, a 55-year-old guy or a 60-year-old guy that suffers the same injury, it might be worthwhile to get some x-rays. So back pain is a common injury. And then lacerations of all sorts, all parts of the body.
Is there anything you can tell people to do to prevent them as far as being safer, being...
Well, one thing that we do at our house is we keep all the knives on the side of the sink and wash them without putting them into the soapy water
Me too.
until it's time to wash each one,
Right.
rinse it off. Because a lot of times people throw their
Throw 'em
hand
all in.
Yep, throw their hand in there and pull it out, kind of a bloody mess.
And then they get to see you.
And then they get to see me. And fingers are very,
Okay.
very painful to have Novocaine injected into.
I understand. Trust me.
And then sewn up. Same with broken glasses. You know, you just have to fish it out with something beside your hand because that's probably the second most common
Okay.
cause of kind of dishwashing-related lacerations.
Okay. And we're still doing tetanus shots these days, right?
We are doing tetanus. We actually are currently doing a new tetanus shot called a Tdap. Which
Oh,
has
tell us about that.
Tdap has a pertussis component to it. Pertussis, of course, is what causes whooping cough.
Okay.
And we have seen, as a matter of fact, I diagnosed one 3 or 4 months ago, a fellow that came in with chronic cough, was on all sorts of antibiotics, and finally I did a pertussis, or a whooping cough screen. He was probably in his 30s, and he ended up having whooping cough.
Okay.
So we're seeing a resurgence, and
It's interesting.
not so much the resurgence in adults that's the problem. It's the fact that they can transmit it to unimmunized newborns, and it can have really serious repercussions. Matter of fact, kill them. So
Okay, not good.
we have replaced our tetanus, which was the TD, tetanus diphtheria,
Right.
with the Tdap, which is tetanus, diphtheria, and acellular pertussis.
Excellent.
Little education.
I didn't know that.
There you go.
That's why I do the show, so I can learn.
That's right.
We've had tonight's guest is Dr. John Landis. We're just talking about routine stuff you see in the emergency room, why you come to an emergency room. We touched a little bit about concussions. We talked about wearing helmets, driving in a safe zone, being safe.
Being safe.
Motorcycles?
Motorcycles?
Motorcycles, donor bikes?
Motorcycles.
Not good.
Well, I think the repeal of the helmet law was a bad thing.
Okay.
Really bad thing. You know, you are taking yourself, I mean, you got to wear a seatbelt in a car, for
Right.
crying out loud. And you're going the same speed with no
I
seatbelt
understand.
and no helmet. To me, it doesn't make sense. I know there's avid motorcycle riders out there that will completely disagree with me.
Right.
But
But you're on the front lines and
I'm
get
on
to
the
see 'em.
front line, and that's the safest thing you can do is wear a helmet. I know it looks cool not having a helmet, having that ponytail flopping behind you.
Now,
But,
careful. Not everybody has the opportunity to have a ponytail.
well, right, I couldn't have one.
I understand. Well, you could. No, you could. Certainly better than I
It'd
could.
be a
that's for
scary
sure.
ponytail.
Tonight's guest has been Dr. John Landis. The highlights you can watch on No, I'm just kidding. You can watch this on the Internet.
Is this on the Internet?
Yes, it is actually on the Internet. See, now I taught you something.
Yeah.
If you just Google Ask the Doc, put my name in there, you'll find it. They usually take about a month or two to load up. It's on the video, Google Video, believe it or not. Why you'd want to do that? It's okay. We encourage it. If you have questions, want to come to the ER, call. They're happy to talk to you on the phone. We did ask a question earlier, which was the Blue Oyster Cult and Don't Fear the Reaper, and the name of the album, Agents of Fortune.
Agents of Fortune. Well, there you go.
There you have it right there.
I think we need more cowbell.
We need more cowbell. There's absolutely no question about that. Look, be safe out there. Go slow in those school zones. It's just ridiculous. There's no excuse to speed in a school zone. If you need us, we're there 24/7, the emergency room,
724-745-3077.
724-745-3077. Out of time, call collect. We have 18 beds ready to serve you. Little wait, if any. Board certified docs willing to see you and take care of anything from bug in the ear,
To a
tree limb in the neck.
We will take care of it.
Be careful. Wear your seatbelts, as John said. Wear those coconut protectors. And stop and see us in sometime, hopefully just to visit. We'll see you next time. Thanks.